I think people are expecting much too much from the National Health, and I do think perhaps people forget that it is the general public that's got to pay for it.
As the patient, you just think, you haven't fixed me, or you're not dealing with me quick enough, and I'm annoyed, rather than thinking they've got an extra 20 people to see. It's nice to see it from their point of view.
But I'm all positive, you know. I think it's a great thing. I think the people that are around are talking to you, you know, and they're explaining things, and I think it's very positive. My only concern is how far will this be taken?
The professionals don't always realise that the public have questions and concerns.
I've been to the public one already, and that gives you a very different perspective because it's coming from patients and users. And then you come to an event like today's and you're suddenly hearing it from the expert side of things. It's about understanding where both sides are coming from. There's never an easy solution. If there was, we'd have found it a long time ago.
Because we're all in it together. It's not just the NHS has to deliver it. And certainly from my perspective, with being part of the link, Pathfinder Health Watch, I think that we have a part to play in that, and every individual member of the public has a part to play in it.
The specialist centre, I think that sounds absolutely amazing. Whereas before, the way they put it, you'll have a hospital that might carry out 6 operations of a specific type within a year. Whereas if you have a specialist centre, then they could carry out 50 to 60 similar operations in the course of that year, and you're going to have the more experienced staff and the nurses of how your treatment and the aftercare. And if you've got more faith and confidence in your doctor and the nurses, then that's going to help you get better quicker anyway.
And I like the idea of specialist centres, but I don't know how that's going to save money, because each specialist centre is going to have those specialist people, which are going to have to have those specialist equipment as well, and all that specialist equipment is going to all cost money. So again, I think in theory that sounds like a good idea, but in my mind I'm thinking it's still going to cost a lot of money, but worth talking about.
I've been very sceptic because, you know, bad experiences with GPs or, you know, Mayday, which is the local hospital, kind of, you know, you tend to not go to your doctor as much because you kind of lost that, you know, patient care and understanding.
My father suffered a stroke about 7 years ago, and then since then he was assessed as not being able to look after himself, so sadly for the family, he had to go into a home. He was a pretty strong person for his age group, and to me, to have an infection and go into a hospital in this country, and then a few months after that they sort of told the family he's only got a few weeks to live. It was purely down to the lack of care, the negligence in the hospital, because, you know, as much as we tried to sort of speak to the hospital and kept complaining about the level of care or non-existent level of care, we had to be quiet to a point because he had to be left in there.
I went to Epsom Orthopaedic Centre, run by the NHS, and I can't fault them. The aftercare was absolutely brilliant. Everything was set in place when it was supposed to be set in place. I was only in hospital 3 days, but then I got aftercare when I came home. And so I think that these centres that specialise in things is a very good idea.
It has always sort of frustrated me that people with non-emergency injuries should turn up at A&E.
We all know that going to A&E or going to emergency services isn't quick because of the large amount of people that need to go. Everyone needs to remember that everyone's health is equal, no one's better than anyone else. And we need to remember that doctors do the best they can at the moment, and that we need to sort of contribute by being more patient with them.
One idea that I thought was really great was the idea of a, what was the word? It was a incident ward, urgent ward in a hospital near the A&E that people that require urgent care can go to. That seemed like a really great idea to me.
The problem seems to be that we do have, at the moment we do have some walk-in centres, but they're not very well advertised.
I never heard about urgent centres or emergency. I didn't know the difference.
Or something.
I didn't walk-in centres, and I've never heard of those in my area.
So I think it all boils down to the sort of information that you're getting. It might be out there, but it's not easily accessible. No. So I think it definitely, people need to be educated on where to get information from, and it needs to be simplified.
There was a discussion about the maternity, about the closing down the 2 units to make 2 larger units. And then we had two people on our table that were just arguing against the fact that it was that it's because it's obviously going to be harder for people to get to it. And then there was the argument between saying that you're going the distance to get better care because the care is obviously more focused on people.
I recently had my daughter, 5 months. She's 5 months old now. We had to wait around 5 hours to get a bed. And there were like sofas, normal sofas to wait for. It was okay for me, but especially for my wife. She was in labor, and I could see as well that the staff were trying their best, but because of the limited resources, I think that was the problem there.
The only good experience we had was with the special care baby unit. Other than that, it's all been quite bad.
Difficult decisions will need to be made with regard to patient choice, with regard to possibly capping the number of births in each hospital, and also whether people travel out of area to different areas, whether there will be 4 hospitals or 3 hospitals. And they're huge decisions, and although I welcome the opportunity to have an input, the local parents need to have a say.
I was surprised on how many 0 to 1 year old children had attended A&E. Maybe something could be help parents, maybe if they was given some pamphlets, and when their child had got a cough or a slight fever, maybe they, instead of taking them to the A&E, they could see and monitor their child for a short period of time.
I think if we can integrate the number of GPs practices, which is like scattered all over the area, we can just integrate them in one major center, or number of major centers, or what we call the polyclinic, where we can where the GPs can deliver better service for the patients, and that will reduce the pressure on hospitals.
My father is disabled, and over the last 2.5 years, he's had to visit his GP regularly, up to 1 or 2 times a week. And it's unfortunate that he has to wait for a period of anything between half an hour to 2 hours. He's never seen on time. If we have a surgery that possibly has, we'll say, 6 doctors practicing at a time, if they put, we'll say, 4 of the doctors who see patients maybe for 5 to 10 minutes maximum, which they know that their symptoms are of, we'll say, they've got a chest cough or something, that they can diagnose and give them some medication quite quickly, so as those that are coming in for the trivial things can be seen and away.
I do believe that the resources and the way care is delivered for people with dementia when they have emergency admissions could be improved, and it's very important that there is good training for staff on the hospital wards, and also perhaps for more care to be delivered in the home. Not all the staff seem to be aware that someone has dementia and what this will mean in terms of their need for care, and potentially they don't always have enough food, being given support to eat the food that they're given, and that drinks are placed out of their reach, so they can't even have any idea of having a drink.
What I really came to say and try to make sure is that mental health doesn't get lost in this whole change. The problem is mental health always seems to be at the bottom of the pile, and I think it's mainly because people don't understand it, or they're almost like scared of it. And there's still a terrible stigma attached. If you say to somebody, I'm suffering from mental health, it's almost like, ooh,